Rhinoplasty is something that I do quite a bit of. It's since I specialize strictly in facial aesthetics, it's a large part of my practice. A lot of physicians who do this sort of work not only do rhinoplasty and facelifts and other things we're going to talk about, but also do body aesthetics and spend most of their time doing that sort of work. Patients that come to me strictly see a doctor who does facial aesthetics, and that's all I've done for 20 years. Now when it comes to the nose is probably the most difficult thing that is done in facial aesthetics. It's every patient's different, every nose is different, the goals are different, the skin thickness is different, the strength of the cartilage underneath is different, how the nose relates to the cheekbones and to the rest of the face varies from patient to patient. It's really difficult for any physician to categorize or take a nose and just put it into a formula and come up with a technique that works on every patient and gets you the same result. It's just not possible. So it takes a lot of experience and a lot of expertise to do a rhinoplasty that looks natural. And the way it's done is you do a procedure that involves reshaping the cartilage and the bone underneath the skin envelope of the nose. And then the skin envelope of the nose will take the shape of the cartilage and bone underneath. It's important when you're doing it to take into consideration the strength of the chin, how far the nose projects from the face, the rotation of the nose, and factors such as that. Now, if you look at all surgeons nationwide who do rhinoplasty, unfortunately the reoperation rate after a procedure on the nose is around 20 to 25%. So that means that about 1 in 4 patients that have a rhinoplasty done is going to end up having another one done. Now, fortunately in my practice that is much lower. It runs around 2 to 3%, maybe 4%. It's pretty low, and not because I'm Michelangelo or because of some inherent genius. It's mainly because I've just done a lot of rhinoplasties throughout my 20 years of strictly doing facial aesthetics. And any revisions I've done historically have always been very minor. So when it comes to choosing a surgeon to do your rhinoplasty, you have to be pretty careful and make sure that they not only perform the procedure routinely, but have results that are not going to end up resulting in further surgery down the road.